Methylprednisolone is a corticosteroid that shows anti-inflammatory actions. It is available as tablets for oral administration, and it is also available as an IV solution. Methylprednisolone can be used for a number of inflammatory conditions in the body. It can be used to treat inflammation of the skin, eye, stomach, joints, and lungs. It also suppresses immunity in autoimmune disorders. Just like its wide activity on various organs, it can also show its adverse effects on multiple organs in the body. Therefore, it is highly essential to know the important facts about this medication, like how to take it, how long it should be used, what are the common and serious side effects, what is its effect on various organs. So in this video, let's cover all such key facts about this medication. If you find this video useful, please hit the like button and share this video with your friends and relatives. Please subscribe to our channel to support our work. First of all, let us see how to use methylprednisolone. You should start methylprednisolone at very low dose to minimize side effects. Typically, it is started at a dose of 4 mg. The dose can be slowly increased based on the requirement. The exact dose of methylprednisolone depends on many factors like age, purpose of use, and other coexisting conditions. For example, to treat many inflammatory conditions, it can be given up to 48 mg per day. However, with higher doses, side effects are more pronounced. Therefore, dose can be increased whenever the benefits outweigh the risk. Even when you are going to stop the dose, it should not be stopped suddenly. Sudden withdrawal of methylprednisolone, especially at higher doses, can result in sudden weakness, dizziness, fatigue, body pains, irritability, and loss of appetite. Therefore, the dose of this medication should be slowly reduced over a few days to avoid withdrawal symptoms. The duration of the treatment is individualized based on the severity of the inflammation. However, repeated use at greater than recommended frequencies should be avoided. Effect on glucose levels. Methylprednisolone can increase the glucose production from amino acids. This results in increased glucose levels. So, if you are using methylprednisolone for a longer time, better check your glucose levels regularly. In people with diabetes, an increased dose of insulin may be required to control glucose levels. Effect on potassium levels. Potassium levels may be reduced with long-term use of methylprednisolone. This may be more pronounced when you take other medications like diuretics that reduce potassium levels in the body. Low potassium may result in weakness and irregular heartbeats. Mood changes. Use of methylprednisolone can produce a change in your mood, and it can produce symptoms of depression. With long-term use of methylprednisolone, you may have increased anxiety, insomnia, and behavioral changes. So try to monitor the development of any mood swings and difficulty sleeping while using this medication. Effect on eye. This is another important effect on which you should focus. When you use methylprednisolone at lower doses for a short period, you may have no significant effect on vision. However, at higher doses with frequent usage, methylprednisolone can cause changes in your vision. It also increases the risk of cataracts and glaucoma. The risk may be further enhanced by other factors like your age above 50 years, family history, and diabetes. So, if you observe any reduction in your vision and eye pain, immediately consult your doctor. Regular eye checkups are recommended for people with risk factors. Next one, allergy. In a few people, methylprednisolone may cause allergic reactions leading to swelling of throat, face, and lips. It can also cause itching and skin rashes. It is a hypersensitive reaction not observed in all people. However, if you find such reactions with use of methylprednisolone, immediately it should be stopped and replaced with an alternative agent. Effect on heart. Use of methylprednisolone may increase your blood pressure. Even though it has less mineralocorticoid activity, it can still increase the risk of fluid retention. This may result in swelling of your ankles, feet, and hands. An increase in the lipid levels may also be observed at higher doses. All these conditions may increase cardiovascular complications. Live vaccines. Methylprednisolone reduces your immunity. Therefore, it may increase the risk of infections. It can also cause a delay in wound healing. Suppression of immunity plays a significant effect when you take live vaccines like the flu vaccine or the chickenpox vaccine. These vaccines contain disease-causing pathogens that are weakened so that they cannot induce a full infection. They are sufficient to stimulate your immunity to release specific antibodies. However, in people who are taking methylprednisolone, immunity is suppressed. This may increase the risk of real infections with these live vaccines. Cushing syndrome. This medication can bring about changes in fat deposition in your body. It can produce swelling of your face and increase redness. It can cause roundness and puffiness in your face. Fat may be redistributed to the trunk and back of the neck. All these symptoms are collectively called Cushing syndrome. These are due to hormonal changes in your body that may take a long time. Therefore, these side effects are generally observed in people using this medication for very longer periods and frequencies. You can also find growth of hair on the face and increased acne. When to avoid? It should be avoided in people with a history of peptic ulcers, severe cardiovascular diseases, uncontrolled hypertension, osteoporosis, and glaucoma. However, in mild conditions, methylprednisolone may be used with caution when benefit outweigh the risk. Your doctor will assess whether it is suitable for you or not. Effect on weight. Like many steroids, use of methylprednisolone can increase your appetite. This may increase the risk of weight gain. As this medication can also increase fluid retention, glucose levels, and fat deposition, all these may add to your body weight. Effect on skin, bones, and muscle. Methylprednisolone can cause muscle weakness and damage to muscle at higher doses. It can also weaken your bones. That's why in people with a risk of osteoporosis, this medication should be carefully used. It can make your skin thin and easily broken. Gastric side effects. At low doses, the effect of methylprednisolone are mild and well tolerated. It can cause nausea and abdominal discomfort. To minimize these side effects, it may be taken with food. However, long-term use of this medication may increase the risk of ulcer formation and gastric bleeding. Therefore, it is better to keep the dose of methylprednisolone as low as possible. These are the important facts that you should know before using methylprednisolone. It has several benefits in reducing inflammation, but at the same time, it is packed with multiple adverse effects. Proper use of this medication at right dose and at the right period can minimize these side effects. That's all for today. I hope this video is useful to you. Please subscribe to our channel and hit the bell icon to get the notification on upcoming videos. Thanks for watching this video.